Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome everyone to the Lead Change podcast. I am so excited to have Dr. Akanksha Mehta as our guest on the podcast today. Dr. Mehta is a professor of urology at Emory University School of Medicine and a diplomat of the American Board of Urology. She earned her MD and completed her urology residency at the Alpert Medical School at Brown University. And following a fellowship in male reproductive medicine and microsurgery at Weill Cornell Medicine in New York City, she completed a Master of Science in Clinical Research at Laney Graduate School at Emory University in Atlanta. She subsequently joined the faculty at Emory Urology. Dr. Mehta is Director of Male Reproductive Health for the Emory Reproductive Center, which provides comprehensive and multidisciplinary fertility care for couples in the Southeast. She is passionate about teaching and training future leaders in medicine. She serves as the Residency Program Director and the Vice Chair of Education for Emory Urology and works with medical students, residents, and fellows. She co-chairs the Society for the Study of Male Reproduction, which is a combination of Society for Male Reproduction and Urology Education Committee. She oversees the Andrology Fellowship Match as well as the American Society for Reproductive Medicine and Society for Male Reproduction and Urology Fellows Symposium. In terms of professional service, Dr. Mehta has served as a member at large for the ASRM Board of Directors and chair of the Urology Care Foundation Reproductive Sexual Health Committee. In each role, she has demonstrated a commitment to advancing clinical care, education, research, and advocacy missions of the organization and to support its growth and sustainability through a collaborative leadership. Akanksha and I were interns together at Brown and Rhode Island Hospital several years ago. For those listeners who may not be familiar with surgical training, intern year is a combination of rotations in your specialty. So for me, orthopedics, and for Akanksha, urology, and then several general surgery rotations. So we worked very closely together during that year and stayed really good friends throughout our training. We've, of course, both been quite busy in our lives and careers over the past several years. Early in last spring, we realized that we were both selected to participate in the Executive Leadership in Academic Medicine program, which is a year-long leadership skills training program for women in medicine, and we are actually in the midst of that program now. So I'm really excited and so happy to reconnect on this podcast and have the opportunity to discuss some of Akanksha's work-related and leadership experiences with all of you. So Akanksha, welcome to the podcast. I'm so happy to have you here.
Thank you so much. I really appreciate you inviting me. And what a treat to be on a screen with you, Mary, always.
Yeah, thank you very much. So before we dive in actually to some of your many significant and very impressive leadership roles, can you share with all of us a bit about your clinical practice and really highlight some of your areas of expertise and interest?
Yeah, sure. So I am a urologist, as you mentioned. I focus in this very small part of urology, actually, which is male reproductive and sexual health. And that's been my fellowship focus for clinical training as well. My surgical skills are primarily in microsurgery, which is, again, a small part of urology. And my day-to-day, my week consists of seeing patients in the clinic and helping them build their families, as well as seeing males who are cancer survivors and helping with sexual function recovery after they have gone through cancer treatment. We do a lot of survivorship care in my practice. So fertility preservation, urinary function, and all other aspects of survivorship care are also part and parcel of my practice.
Wow, yeah, thank you so much for sharing and kind of expanding on that. I would have had no idea all that's involved in that specific focus within urology. So that's so interesting that you get to work with actually a pretty broad group of patients and really help educate them. And you're looking at the reproductive side, but from a male perspective, I think, certainly before having these interactions with you and hearing about your training, like, I feel like many of us hear more about reproductive endocrine on the sort of female, on the women's side, but it's really interesting to learn more about all that goes into like what you're doing in your practice.
Yeah, it's true. There's not very many of us in the country. So I would say, our society membership is about 300, maybe 350 total
Wow.
in the country. That includes international members and some PhD researchers. So there's certainly not many of us clinicians. When I was going through training, there were only 7 or 8 fellowship programs. Now there are 16, so that's wonderful. Feel like every year our field trains somewhere between 18 to 20 fellows, maybe a couple more, depending on the year, which is very small numbers compared to how many reproductive endocrinologists are trained every year. So partnership for us with our REI colleagues is really key. I'm fortunate to have a great group here at Emory that I work with, and I think everyone who does what I do, takes that partnership really, really seriously.
Yeah, that's a really good point. I guess I wouldn't have even thought about it because I don't live in that world, but like that partnership and that collaboration is so critical. And so it's great that you emphasize that you certainly within your own institution, but that you see your colleagues who do this, they're also obviously working very closely with their REI colleagues at their own institution to really optimize care of the patients, of the couples, of their families. Fantastic. So in addition to your clinical practice, you are very actively involved in research too. And I understand that you've been a guest researcher in the Division of Reproductive Health at the CDC. So congratulations, that's amazing.
Thank you.
What did your role with the CDC entail? And do you have a main area of interest or focus for your research?
Yeah, so when I moved to Emory and when I enrolled in that master's program, my interest was really looking at these large data sets and wanting to build a health services research enterprise focused on male infertility. This was still a relatively new field at the time. I did the master's program to particularly get those skills to look at large data sets. And we're fortunate on the Emory campus. I mean, we literally share a road with the CDC campus. So there's a lot of cross collaboration and obviously a lot of data and expertise that gets shared. I got connected with the reproductive health division pretty early on, got to sit in on some of their meetings and look at all the wonderful work they were doing. The majority of the work was focused on female factor fertility and female reproductive health. So I was hoping to duplicate some of that and shine some light on the male side as well. And my early kind of work with that group addressed some of those, male factor issues and how that manifests in terms of reproductive outcomes, even IVF outcomes. What are young men of reproductive age doing in terms of testosterone use, for example, that can affect fertility, and how our current technologies that we are using for improving reproductive outcomes are, modified by the severity of the male factor. So my work, CDC data sets as well as others, has really focused on getting access to care. So how are people accessing care? What sort of care do they get depending on where they are in the country? And then what their outcomes are depending on their social demographics, their background, their medical health, and how we can make that better.
Yeah, that's incredible. And what are, not to necessarily put you on the spot, but are there some key findings that you have come to realize in looking at all these different factors?
Yeah, I think in general, circling back to what we were talking about at the start of this conversation, the prevalence of male factor infertility is really not well recognized, whether it's social understanding or some stigma there. But most of the time, when men find out that there is a male factor issue, they're surprised to hear it. Most of the time when physicians find out that there is a male infertility specialist, they're surprised to hear it. So I think education, both for the public, but also for healthcare professionals, is super important. And then the other thing is that the resources that are currently available for infertility research or clinical care are so heavily focused on the female side that we have a long way to to go to build up those resources for the male side. But what's more important now, I think, than ever before, as our understanding of the biology evolves, is that the male factor of sperm quality, sperm number, is so important. Even when we're using technologies like IVF, those are not guaranteed slam dunks if you're working with poor quality sperm. So really anything we can do to improve paternal health and paternal sperm quality is going to be important in ensuring a good reproductive outcome for that couple.
Yeah. Wow, such important points. And I'm glad that you and some of your other colleagues are so focused on trying to understand this better and help the patients and your other medical colleagues. I mean, like, I have learned more about the male factor in the past 10 minutes than I knew before. Like, seriously, I mean, I think it's just, we don't learn about this in medical school, certainly. I mean, I don't even know that now in 2025 that medical students are learning about this, but so important that the work that you're doing. So thank you. And you've had several important leadership roles throughout your career. I know that you currently serve as program director for the urology residency at Emory. So I'm curious, when did you start in that role, and what are some of your responsibilities?
Yeah, so I took over this role unbeknownst to me unbeknownst to me that COVID was coming in the year of COVID, I should say. So academic year starting 2019, so July of 2019. And I was taking over from a colleague of mine who had served in this role for a long time and had really seen the growth of this program over the year. It's hard to really appreciate the enormity of the role until you step into it. You sort of think you understand it, but all of the interpersonal challenges, the administrative stuff, the busy work, I think it's hard to get a full appreciation for it. But residency program director is ultimately responsible for running the day-to-day residency program. So figuring out where the residents are rotating, what their training is going to look like, are they meeting the metrics that they should be meeting to graduate as a qualified surgeon. In our case, from this program, are we abiding by all the rules and regulations that are set forth by our national organizations like the ACGME for training our residents? But also, the role makes it so that you are responsible for setting the culture of your department and how the residents interact between themselves and resident and faculty interactions. And if you have good communication with the residents, then they become participants, really active participants in their own education and in growing and supporting the program. So you, as residency program director, are doing this day-to-day work, but you're really also responsible to see the long-term growth of the program and stay up to date with technological innovations, educational innovations that are happening in urology at the national level, and how we can import and apply some of those in our program so that we're staying abreast of the needs of trainees. It's funny, even from the time when you and I trained as surgical interns, surgical training has changed so much. And what we do in practice today is so different from what I learned to do as a resident. So in a way, you're kind of training these young physicians for a future that you don't really know or cannot imagine, but you want to equip them with the tools that are going to allow them to be adaptable and grow into that future. So I find it really rewarding, really, really exciting.
Yeah, I'm so happy that for you that you're serving in that role. Like, you, I'm sure, are absolutely tremendous, and I'm sure the residents love you. You have a really broad view, as you've just explained to me, a broad view of what you're doing, what you want for the residents, how you want them to be successful, not only in those years that they're there with you, but then as they move into their fellowship and into their career. And so you really are looking long term. And I love too that you brought up that, like, what we're doing now, like, we did not do 12 years ago or 13 years ago or whatever in our residency. Like, we did not, but you can't anticipate the changes, but you're exactly right. It's just equipping them with the skills so that they can be prepared to adapt, and also be willing and eager to stay up with technology, stay up with novel techniques, be active in the societies, be reading the literature. and really doing everything they can to provide excellent care for their patients and optimize outcomes. And so that foundation is what you and your colleagues at Emory are helping to lay for all of the urology residents there. So it's a really important role.
Yeah, absolutely.
Yeah. And in being in academic medicine, right, you're very actively involved in research. We talked about some of your specific interests. You're involved in medical student and resident education, and of course providing excellent patient care. So can you share with all of us, like, what is the main driving force for you and the motivation in all that you do in your career?
Yeah, I think it's an interesting question. It's a question I ponder from time to time because my week is, I would say, pretty evenly split up between those three missions. And I mean, from a clinical standpoint, like, I love my job. I love the people that I work with. I love the patients that I treat. My colleagues are so smart. I'm always learning from them. I love operating, being under the microscope in the OR. I think my job is so rewarding. Like, I could not ask for a better clinical job. But it's providing excellent clinical care. Obviously, you're helping the patient in front of you. These other things that we do in academic medicine give us a little bit broader impact, so we are training these residents who will then go out and help so many other hundreds and thousands of patients in their career. And that, gives us a little bit of pause. And I think all of us who are in academic medicine, yourself included, gain a certain amount of, I don't know what the right word is, but happiness from that, I guess, contentment from that, to know that you have played a role, not just in treating the patient in front of you, but in all the other patients that your trainee is also going to touch during their career. And I think research is very similar to that. You are coming up with new protocols, new discoveries, things that are maybe a little bit better or maybe not as good as we once thought they were. And it changes the field a little bit and how we think about things a little bit. And it has the potential to impact so many other people. I think that's the part about academic medicine that keeps us doing what we do. I mean, I don't think any one of us would be here if we didn't love our patients, but it's the extra stuff that comes on top of patient care that brings satisfaction to many of us who do what we do.
Yeah, I agree completely. But I think it's all of those things are kind of complementary and create the whole picture, and all are incredibly gratifying, and we learn tremendously, and we're contributing in all those ways. But I think, in talking about training, you're helping to educate residents or fellows, and then the impact that they will have on their patients, right? It's substantial, and that's a role that we don't take lightly, but we understand, like, the impact and the opportunity. But all of these things, doing research, speaking at meetings, being on committees, then of course our clinical work, the stuff we're doing with residents, all of that actually helps the other, right? They all interact with each other. The research we're doing then ultimately benefits our patients. Our residents learn from that work. They also have opportunities to go to these meetings. So I think they are all interrelated and really create the whole picture within academic medicine, and that we all love each of those components, as you were touching on. It's like, it's kind of that all creates the whole picture of being a physician in academic medicine. You have had several other important leadership roles too, and I know you served as president of the Society of Women in Urology, so that's fantastic. I am curious to know, what is overall kind of the focus or goal of that society, and what were some of the main initiatives that you were able to help implement as president?
Yeah, great question. I love talking about this. So there's very few women in urology compared to the patients that we treat. I don't know what the comparable number for orthopedics is, but I imagine it's low as well. When I was in training and about to enter the workforce, the proportion of practicing urologists that were women was about 6 to 7%. And now, 12 to 14 years later, we are only about 12%, maybe a little less than 12%. So not a tremendous uptick, but an uptick nevertheless. But of course, in urology, as in orthopedics, we are treating pretty much 50-50 in terms of men and women. So we're seeing a lot of female patients. Part of the focus of this organization, I think, and it has probably evolved since it was created, initially it was to provide a space for women urologists to have some camaraderie, but as the organization has evolved, it's taken on sort of a life of its own. And now the focus is to really provide professional development opportunities to help women urologists succeed in whatever it is that they want to do. For those of us that are in academics, how do you climb that academic ladder? For those that are in private practice, maybe you are looking for a leadership role there. Maybe you are looking for streamlining your practice. Maybe you are looking for career guidance and advice. There's a lot of mentorship that happens in this organization, peer mentorship, as well as, top down and down up mentorship. And of course, I think it continues to be a safe space for building connections and camaraderie. If you asked anybody who has attended these meetings, they would probably tell you the strongest point is the networking opportunity, because you get to rub shoulders with giants in the field that you would not otherwise ever get to meet, right? And I remember being my first meeting that I attended, which was back in 2014, there were a couple of women who were chairs of departments at the time, probably only just two, but they were at this meeting, and there were all these program directors, and they were at this meeting, and there were all these women who were big names at urology that I would never otherwise speak with because they were not in my subspecialty, but they were at this meeting. So it was a really wonderful opportunity to get to know some of these giants, intimately, and get some pearls of wisdom from them. And membership has grown steadily. It's actually one of the fastest growing memberships in terms of urologic professional societies. And when you join the board, so it's a pretty long term on the board, we serve for 8 years, and you end with the president's term. So you get to see the full evolution of the organization. And in the time that I was involved, that finally rotated off, a lot of changes happened. We created much more emphasis on getting residents and then even medical students involved in the organization, sort of increasing the pipeline and attracting more women into urology. There were a lot more mentorship programs that got started. There was always a attending to resident mentorship program that happened, but now there's a resident to resident and a resident to medical student and mid-career women to senior career women mentorship that's happening. And there probably were not very many mid-career or senior career women now, but now there's a need for it, right? So that's a great problem to have on our hands. And I think the makeup of the organization has shifted as well, where there was probably a time where we had many more private practice urologists, and then we shifted to having a lot more academic urologists, and now we're probably back in this sweet spot of 50-50, which is ideal for an organization like this because you want to have that diversity. So that's been wonderful to see. And then some of the other initiatives, being able to do our own census and surveys within our group to really look at what it is that the women in urology want and need from our profession. That's been huge. We never had that voice, and for AUA, which is our parent organization, to recognize this society, now we have a seat at the table when it comes to planning the annual program, and we give our input into the census and the questions that get asked every year. That's huge.
That is amazing. So great to hear about the evolution of that too. And you were mentioning too, the percentage of female urologists and how it has increased from when you finished training to what it is now. So within orthopedics, about 7% of practicing orthopedic surgeons are women still in 2025, but about 22 to 23% of junior orthopedic residents are women. So we are making progress. It's slow, but it's happening. And also within ortho in terms of a comparable group, there's the Ruth Jackson Orthopedic Society, which is sort of similar. But I wonder too, in the Society of Women in Urology, are there any male members?
There are now some male members. For a long time, I think it was sort of the identity of the group was still getting formed. And we had said, no male members, no male speakers, nothing. And a few years ago, I want to say 3-4 years ago, somebody approached us and asked if they could be a member, and it was a male urologist. And it was also around that time that this like idea of allyship was catching on. So we said, of course, like you can be a member. We opened it up. We actually did this whole big allyship thing at the national meeting where we invited a lot of our male colleagues who, many of us considered our allies in our day-to-day practices to the sessions for our subspecialty like meeting. And it was really well received. Honestly, we usually do like a breakfast at the AUA. So it used to be like, maybe 100, 200 people. And once we opened up the allyship space, I mean, this was like standing room only, like hundreds of people. So it's been really, really good. And I think, even folks who are not members of the organization, who are maybe male urologists, are eager to hear about how things have taken shape and like the changes that are being made at the national level in response to some of the suggestions that we've put forth, because I think it benefits the field, right? It does benefit our patients, our trainees. It makes us all better.
Yeah, no, I agree completely. And that's fantastic that the group has opened up membership to your male allies. That's exactly it. Because, I mean, the reality is like we need the support from our colleagues, from our allies to continue to foster growth within the field as a whole, right? But to foster diversity with really the ultimate goal of just improving care of our patients, improving the training of our residents. And so it's wonderful that there was so much interest and continued interest and support from your national organization too. That's tremendous.
Yeah.
And what were some of the most valuable leadership skills that you learned or that you took away from your year as president of the Society of Women in Urology?
I think the most important one was this allyship piece. We were battling for so long, like, do we be inclusive or do we be this like super secret society? But as you said, it's hard to get big things done without having allies on the outside. And many of us struggle, I think, particularly as women, like asking for help because we are so used to like getting it done and doing it ourselves, and we don't want to show weakness, right? And seeking out allies, sometimes I think we feel like, oh my gosh, we're showing weakness. But I think you come to a point in your career where you realize, gosh, nothing big is going to get accomplished without having that partnership and that type of mentality. So you ask for help. You're surprised when you like receive it, and you're so surprised when like you get this wonderful product at the end of it, but it becomes like a self-fulfilling prophecy, right? So one time you see the success of that, then you're like, okay, well, let's do something else together. Let's expand a little bit more. Let's think about this a little bit more. I think that probably for me was like the best learning experience, being a part of that team and to see the other women on this board. I mean, this is like such a hardworking board. There's people doing like 12 things at every minute, all the time, and we are all the same, right? Like you and I, we're all like juggling our personal lives, our professional lives. We're like serving this organization because we really believe in the mission of it, and we're so passionate about what it stands for. It just goes to show you that like so much can get accomplished with the right intention and the right partnership.
Yeah, absolutely. That's the key point, right? Is that when you get people working together, private practice, academics, female urologists, male urologists, like senior, junior colleagues, what you can accomplish when everyone has a shared vision and a shared goal. And so that's tremendous, and everyone benefits. So that's a great example of how that partnership can be so successful. And in your career, have there been any like specific or pivotal roles that have really shaped who you are as a leader?
Roles, you mean like things that I have done?
Just, think different points in your career where you say like, wow, that was really a turning point.
Yeah, I think being a residency program director has taught me a lot, and I'm certainly not the same PD now than I was, 7 years ago when I took on this role. It teaches you a remarkable amount of patience, honestly, and the need to slow down and hear voices that are probably not saying the same thing that you're saying and give them import. I will say that, early on in my program director tenure, it was sometimes hard to like filter out differing opinions, because you're like trying to focus on like the immediate work, you're trying to focus on the long-term work. But as I've become more seasoned, I have learned to invite that differing opinion early on, because I found that it helps me deliver a better product at the end, rather than charging through with like-minded people and then deliver something that's not going to be acceptable to like 50% of the residents and the faculty. Invite that other opinion in early so that you can really think about something comprehensively and make it better and make it sustainable. That's probably the biggest sort of teaching point from that role. And then in our clinical practice, but also serving on ASRM, working with the CDC, we are like one little piece of the pie, and there's so many other people also trying to do the right thing. So learning to work with folks of all walks and backgrounds, I think, has been wonderful. And like you were saying earlier, it reinforces all the other parts of what we do, right? What I learned serving on some of these committees, I am able to implement into practice or my interactions with my staff or my trainees and vice versa. And I always joke with my residents that, everything I've learned has come from being a mom, but like it's the same thing. Like you learn a lot of lessons being a parent that I sometimes see myself applying at work and vice versa.
That's fantastic. So true. I have learned a lot by being a mother as well. And the point you brought up kind of a few minutes ago about inviting the dissenting opinion, or just you want to hear everybody's thoughts. I think that's so important, and a really key point that you brought up is that you want to hear everyone's thoughts because it's going to come out at some point. So it's better to hear it early so that you can consider the whole picture and then really work with everyone to come up with a plan that's going to try to appease or to meet the needs of the most people, right? Obviously, we can't please everyone all the time, but so smart to get those opinions early on so that you can consider all of those things. And as we grow and evolve in our careers, I think that we're constantly refining our leadership style. So how would you describe your leadership style, and in what ways do you find that to be particularly effective?
Yeah, I would say I enjoy leading by example. This has been very effective for me in everything that I have done. And I think it opens up, a certain amount of relatability and even a little bit of, again, what's the right word? Vulnerability, maybe, to be that kind of leader. To be open about your experiences, to be open about where you maybe missed the mark or failed a little bit. For me, that comes easily to be able to share that. It's not an embarrassing thing for me. And I think for the people who are listening to that, there is some degree of authenticity that's generated as a result. I have found it easier to win people over on my teams when I have been open and honest like that about my own experiences, good and bad. And I think it's worked for us well, at least at Emory, for me to be that kind of leader. Whether it's leading the residents or whether it's leading the faculty or even our clinical staff in all of the new initiatives that we've implemented, I always try to make sure that I am thinking of, other people and the shoes that they're wearing so that I'm not overlooking anything. And I think that helped too.
Yeah, I bet it helps tremendously. And you raised like several really important points, but I think first, being willing to be vulnerable, I think is absolutely critical. Like you are a person, you're a regular person just like everybody else, but being willing to share those times where there was a failure or things didn't work out, maybe the way you had hoped. I think that builds a lot of trust too. So I'm sure that is hugely helpful in these different leadership roles, and then being authentic, being yourself, and always showing up as yourself. And I think that's certainly a point I'm sure that you try to raise with your residents. You're trying to teach them those skills and encourage them to always show up in their own authentic way, and that will get them to where they want to be, where they need to be throughout their career. So I think those are really important lessons that you're bringing to the program and to your faculty. So that's awesome. And we all work with so many different types of leaders, good leaders that we respect tremendously, but also leaders that maybe you just didn't connect with as well. So in those types of interactions, like what did you take away from it? Take away from a person that where you're like, well, I maybe don't necessarily agree with their leadership style. That doesn't quite resonate with me, but what did you take away and how has that helped shape your own leadership style?
Yeah, and sometimes you take away what not to do, right? And I tell my residents all the time that even residency training is just as much about learning what the right thing is as it is about learning what the wrong thing is. And maybe their leadership style doesn't resonate with you, but either there are certain aspects of their leadership qualities that may appeal to you, that you may pick up on, so maybe they are a very authoritative leader, but when they communicate very clearly and succinctly, and everybody knows what they're thinking. They may not like to know what they're thinking, but they hear it, loud and clear. So there's probably, aspects of everyone's style that you can learn something from. But, my sort of key takeaway is always, how is this person perceived as a leader? And what is it about their leadership style that people either love or abhor? And that's what I try to take away. Just one point from everyone that I meet. What do they do really well, and what do they not do well? I think the quality that gets a good leader respected is obviously somebody who cares very much about their team and wants to elevate the team, and that's whether people like you individually or not. That's one quality that everyone appreciates in you as a leader. You're not, always a cheerleader. You're maybe not the warmest person on the team. Like, there's many things that don't necessarily have to be part of being a good leader, but I think you have to understand your team and elevate your team. And if you can do that, regardless of your leadership style, you're, winning the battle, I would say.
Yeah. But excellent points too. I think you're absolutely right that there's so much that we can take away from every leader that we interact with. Whether it's like, wow, that person is exceptional. I want to do X, Y, and Z. I think that is so effective. Or, ooh, I didn't quite agree with that, but I see where they're going with that, mm-hmm. or I could modify it in this way. And so I think that's a really, really important point and so valuable, whether it's on committees or in national leadership, within societies or within our own institutions, that we learn so much from those experiences. And I'm wondering too, you've had these leadership roles, but I wonder too, we're both actively doing ELAM right now, which is a good example of a leadership skills training course, but I wonder if there's been anything else, anything specific that you've done to help, kind of hone or develop your leadership skills, whether it's a particular course or a meeting or a seminar that you've participated in.
So we had actually a leadership development program here at Emory, which was similarly a year-long program. It's called the Woodruff Leadership Program. And that was really helpful. That was probably my first foray into formal leadership development. And it opened up my eyes to how valuable training like this can be. After that, I did a similar thing through the AUA, and the focus was a little bit different. It was really to create AUA leaders and understand the mission of the organization and how you can advance the mission. But, similar skills were taught. And then the opportunity became available to work with a coach, which I did for a year as well, which was honestly so helpful. And I must say, going into it, I was a little bit hesitant about the whole concept. I had heard about other people working with a coach, but I didn't really understand the value that something like that brings until I did it. It really helped me kind of refocus, think about where I wanted my career to go, take ownership of the things that I probably wasn't doing well because of my own stubborn behavior or oversight or stress response, and actively try to work on that. So for me, that was totally amazing after doing the two other leadership development programs. And then Elam has been, also fun. And I'm looking forward to some of the in-person sessions we're going to have this year, because I think those will be very, very different from what we've been doing over Zoom and amazing in a different way.
Yeah, I agree. And those are all great examples. And there are many opportunities, national type meetings,
For sure.
programs within your own institution. And it's just fantastic to take advantage of those things. I love also that you brought up working with a coach. So I've worked with a coach for 7 years. She's amazing. I love her, Claire. And actually, like, I just released the episode with her. She is on episode 5 talking all about the benefits of executive coaching. So
Yeah.
please, for anyone interested in hearing more about that, please check that out. It's really incredible, and I encourage anyone to consider getting a coach. Like, if you have that thought, I think it's been hugely, hugely helpful. So rounding this out, Akanksha, with just a couple of questions, have you read any leadership books that you've found to be particularly impactful for you?
Yeah, so I'll also say when it comes to reading leadership books, if you had suggested this to me like 7 years ago, I would have been like, oh my God, like I would rather do whatever else. Um, and the very first one I picked up was Lean In by Sheryl Sandberg. And I picked it up thinking, I am not going to like this book. And I'm going to tell the world why these books are silly. And then I read it and I was like, you know what, this is actually not half bad. And I put it down and I actually came back and read it again a second time 6 months later. And I was like, oh my God, there are a lot of pearls here that I wish I had heard about a little bit earlier in my career. So that one still holds a special place in my heart because it was the first one. But also, I think she has a very unique perspective on women leaders and what we do well, what we don't do well, and how we can really overcome the obstacles we create for ourselves. So that one is a favorite. And then others that have been influential, it's hard for me to sit down and read a whole book at a time. So I enjoy things that are broken up into chapters. The Harvard Business Review did a great one on emotional intelligence. That was awesome. And I still use that from time to time for my residents or sections from it.
Yeah.
And then the most recent one I read was What Got You Here Won't Get You There, as sort of thinking of next phase in your career. Those are probably the three that stand out. But
Yeah.
Lean In, probably still my favorite.
That's awesome. Yeah, I've read Lean In. That also was an early leadership book for me to read too, and I agree. I took a lot away from that. I love too that you brought in the Harvard Business Review. I think that there's tons of leadership advice there, and I personally, I see little snippets here and there, but I think that's fantastic. And you highlighting just the importance of emotional intelligence, and then what got you here won't get you there. It's so perfect that you bring that up. Like, that is a book I 100% want to read. Like, it is definitely on my list of books to pursue soon. So I'll definitely have to talk to you more about that one. But last question for you, do you have a particularly favorite quote?
Yeah, I mean, there's so many. I think one that, again, is one of my favorites because we have had to implement it here in our department is the quote about culture and strategy and how culture eats strategy for breakfast. I think that's so important. And we went through a pretty transformational change here in our department focused on our culture, our values, our mission, and it was, necessary for the growth of our department. So I hold that one near and dear. And then actually I was chatting with my program director from Residency not too long ago, and he brought up another interesting one about leaders creating other leaders and not followers. And I thought that one was especially smart. And I Googled it and I, figured out who said it. But that's another one that I'm going to file away because I think, very often we think of leadership and, oh my gosh, you're going to lead all these people and they're going to do just what you're going to tell them to do. And that's really not what leadership is. And the satisfaction that we get from our jobs in academic medicine, and I'll use my residents as an example, is when they go out and do wonderful things, right? And that's what makes you so happy and warms your heart and is gratifying and allows you to keep doing what you're doing. It's to see their successes. So that's another relevant one.
Yeah, I love those. Those are so powerful, really thoughtful. And I have not heard either of those. So I take so much from this, and I think everybody listening will too. So thanks for sharing those quotes. Well, Akanksha, Thank you so much for being on the podcast. It has been absolutely incredible to share this time with you and hear about some of the many successes in your career. I really appreciate you sharing your time with us and talking about all these valuable leadership lessons that you've learned. I cannot wait to reconnect with you in person at our first large ELAM group meeting in a couple of weeks. So thank you again.
Yeah, thank you so much. This was so much fun.
Great. Thanks so much and take care. I'll see you soon.
Yeah, see you soon.